You wake up and your mouth feels extremely dry. Your lips are cracked, your tongue feels stuck, and the first thing you reach for is a glass of water. Maybe this happens every morning. Maybe you mentioned it once and were told it is just part of aging. Maybe you have started accepting it as something normal after 60. But the truth is very different. Waking up with a dry mouth every single day is not normal aging. It is a signal. It means your body is trying to tell you that something specific is happening during the hours you sleep. And in adults over 60, this usually points to one of 5 clear causes, and at least one of them may already be affecting your health without you realizing it. Welcome to Senior Health Tips. Let's understand what dry mouth in the morning is really trying to tell you. Saliva is something most people never think about until it becomes a problem. Your body makes a large amount of saliva every day, and it does much more than simply keep your mouth wet. It protects your teeth, helps neutralize acid, supports swallowing, fights bacteria, and even helps digestion begin properly. So when saliva production drops too much while you sleep, that is not a small issue. It is a warning sign. Dry mouth in seniors is very common, but in most cases it is not a condition by itself. It is usually a symptom of something underneath that needs attention. The first and most common cause is medication. This surprises many people. A huge number of prescription and over-the-counter medicines can lead to dry mouth. These include allergy medicines, water pills for blood pressure, antidepressants, bladder medicines, some heart medicines, and even sleep aids. And the effect becomes stronger when several medicines are taken together. Many older adults take multiple prescriptions every day, along with vitamins or supplements, so the combined effect becomes much more powerful. If your dry mouth started around the time a new medicine was added, that may not be a coincidence at all. This is often one of the biggest reasons seniors wake up dry every morning. The second major cause is sleep apnea. This is more serious than many people realize. When sleep apnea happens, the airway narrows or closes during sleep, forcing the body to breathe through the mouth instead of the nose. Nose breathing helps keep the mouth and throat moist, but mouth breathing dries them out quickly. That alone can explain why the mouth feels so dry in the morning. But the bigger danger is the sleep apnea itself. If you snore loudly, wake up tired even after a full night, or someone has noticed that you stop breathing for short moments during sleep, dry mouth may be one of the warning signs. In that case, the issue is not just dryness. It may be poor breathing at night affecting the whole body. The third cause is diabetes, whether diagnosed or not. When blood sugar stays high, the body pulls fluid from tissues in an effort to remove excess sugar. That leads to dehydration inside the body and saliva production drops. As a result, dry mouth becomes more frequent. If dry mouth comes with frequent urination, unusual tiredness, blurry vision, or slow healing cuts, then blood sugar needs to be checked. Many people live with diabetes for a long time before finding out, and dry mouth can be one of the early signs that something is wrong. The fourth cause is simple but often ignored, and that is chronic dehydration. In younger people, thirst usually gives a strong warning, but with age, that signal becomes weaker. Many older adults stay underhydrated without even feeling thirsty. That means the body may be low on fluids all day long, and morning dry mouth may be the clearest sign of it. If you are not drinking enough water across the day, your body may already be entering the night with a fluid shortage, which becomes worse by morning. The fifth cause is Sjogren's syndrome, an autoimmune condition that directly affects the glands that make saliva and tears. This means the body reduces moisture where it is needed most. It is often missed because dry mouth and dry eyes are commonly blamed on aging. But if your dry mouth also comes with dry or gritty eyes, unexplained tiredness, or joint discomfort, this is something that should not be ignored. In some people, this is the real reason behind constant dryness. Now here is what you should do. First, do a full medication review. Write down every prescription, every supplement, and every over-the-counter product you take. Then, take that list to your doctor or pharmacist and ask directly whether any of them or any combination of them could be causing dry mouth. Sometimes the solution is not stopping treatment. It may simply be changing the dose, changing the timing, or using a better alternative. Second, pay attention to your sleep. For the next several nights, notice whether you wake with your mouth open, whether you feel rested or exhausted, and whether anyone hears you snoring or notices pauses in breathing. If there is a pattern, ask your doctor about a sleep study. This can help reveal whether sleep apnea is the real reason behind the dryness. Third, get your blood sugar checked if it has not been tested recently. A fasting glucose test or HbA1c test can help show whether blood sugar is playing a role. This is especially important if dry mouth is happening with fatigue, blurry vision, or frequent urination. Fourth, be more intentional about hydration. Do not wait until you feel thirsty. Drink water steadily through the day. You can also drink some water in the evening, spread out rather than all at once. The goal is to keep the body properly hydrated before sleep begins, not to try fixing dehydration only in the morning. Fifth, for temporary overnight relief, while you look for the real cause, use a dry mouth rinse or oral gel that contains xylitol before bed. Avoid alcohol-based mouthwashes because they can make dryness worse. These products may help protect your mouth and teeth overnight, but remember, they only help the symptom. They do not solve the root problem. One important note: if you take blood thinners, ACE inhibitors, or lithium, talk to your doctor before making major changes to your fluid intake. And if dry mouth comes with pain, trouble swallowing, white patches in the mouth, or unexplained weight loss, do not wait. Get checked promptly. Morning dry mouth may be common, but common does not mean normal. In most cases, it points to something specific like medication, sleep apnea, blood sugar problems, dehydration, or an autoimmune issue. The good news is that all 5 can be investigated and addressed. Once you know where to look, you can take the right next step instead of ignoring the warning. This is Senior Health Tips, and understanding these signals early can make a real difference in your health.